Good evening, I'm Karen Lee. The agencies in charge of protecting children in Colorado are sounding an alarm. They fired off a letter to Governor Polis and state lawmakers demanding more resources to treat kids with severe behavioral health issues and warning of dire consequences if they fail to act. Our political specialist, Sean Boyd, has been following this issue for us for quite some time. And Sean, it is starting to get worse.
Yeah, Karen, people who have worked in child welfare for decades say they have never seen so many kids with such severe behavioral health issues. Kids with deep trauma, violent histories, significant substance use disorders, and a disturbing number of young kids, 5-year-olds, who are suicidal and homicidal. And over the last 6 months, more than 600 of these kids have had to sleep in county offices, hospitals, or detention centers because there is no treatment facility to take them.
Our battle cry, I guess I would say, is it's time to kick it up a level.
Becky Miller-Updike among hundreds of child welfare leaders from across the state to sign on to a letter to Governor Polis and state lawmakers urging them to pull any and all levers to alleviate a crisis that they say is unconscionable and untenable, saying kids are leaving our state or sleeping in county offices, hotels, hospitals, and detention centers due to a severe shortage of residential treatment options.
If we want to treat the high-level kids, we're going to have to invest in the workforce that can handle it, and we're not there yet.
Updike, executive director of the Colorado Association of Child and Family Agencies, 40 mostly nonprofits like Tennyson Center for Children that provide treatment for kids with severe behavioral health needs. Nonprofits that she says need more funding to recruit and retain providers.
It's hard to serve kids with really, really severe mental illness or violent behaviors. They need to be paid a competitive wage, and nonprofits haven't been able to keep pace with that.
The lack of residential treatment has put a strain on county human service agencies. Larimer County Commissioner John Kafalas says beyond money, they need Governor Polis' help.
One of the recommendations is that there be a designated person in the governor's office that can help bring all the parties together and ultimately come up with a solution.
A long-term solution. Jefferson County Human Services Director Mary Berg says while lawmakers have approved one-time funding for more treatment, it's drying up and the need isn't letting up.
We need sustainable funding. We have short-term solutions for funding, but we are deeply concerned that those are going to go away, and then the problem is going to get even more critical.
They told the governor and lawmakers they fear children and staff in stopgap settings will get hurt or worse, that desperate parents will continue to relinquish custody of their children because they feel they have no other options, and that the Department of Justice will launch an investigation of Colorado as they've done in other states.
We need more support, more resources, and more leadership.
So far, the Department of Justice has found Nevada, Alaska, Maine, West Virginia, and other states in violation of the Americans with Disabilities Act because they failed to provide the community-based behavioral health care that prevents kids from ending up in higher levels of care or getting stuck in county offices with no care. Child welfare leaders say the DOJ may come after Colorado next.
Well, Sean, you've learned, too, that this isn't just a problem for Colorado, clearly.
No, absolutely not. I mean, you've seen some of these other states dealing with the same problem. You know, states began shifting away from the residential treatment a few years ago after Congress passed a law that's aimed to address the over-institutionalization of kids, right? The right idea, but what didn't happen is the alternative care settings didn't follow.
All right, stay with this one so we can learn more about it. Sean, thank you.